ye di eni ho komo ye bo diabetes so ye bo hypertension so like say komo bi ebedu we yakomoden ho ye can mental health cra diabetes ebonidi ye bo hypertension di be compare awo na be siesie me body no e dey atwen awo so doctor dey mean diabetes and hypertension
say e was say yet yare bi ase yare bi say hypertension and diabetes e honam yare e ko honam ba bia
omo ye fun
nia edi honam no kan e your brain na wakoma into wakoma na ntwe nye djuma pa baby antwe nko ye diabetes was the same problem into so ba fa yefunu a you must have a very strong resilient body into say diabetes na hypertension be say body na we den
hello ye share your talk life so enne ye babedi awo epe ehun komo ahobo ben ene wo sabi no nyina ye na ye de siesie ye funu ni nipadua no so oba ana bema e de hwe awo kwan efise eduru sa bre season ya yewo mu ya edipa bebre edi areho a wo die no ebi wo farebai ebi ni farebai de wo farebai na ye so anu ebe ye no e wo se ye hu nne na wo areho no obabi ana odofo bi anko dibi eno ane botaya ene me no share talk like so they said no and live well me that is here bedasi ene so me wo Premier Care Hospital Kasoa Tuba area no wo Kasoa na Tuba na nye Kasoa deep ho the way to say Kasoa ko tia ho after toll booth no so free Accra and eba after toll booth no we ye 10 na said okwa Accra back the kwai be na da ho tenten so no aha my favorite road na say na kwan so aye yi kakra but e ho na me wo e ho na Premier Care Hospital wo e ho e na ma ba share doctor for kukudam bebre ya mpese meji o ma dwen no mu nimde no mo woni bi na ye de boa ye ho se nipa otu enkomo yi a wetimi a like ya share awo so de amobi a ohia moa ebia na no pe na wo de beji onipa no and then we and no pay and then you bring depend on time I will show me no. Your doctor Ayetey Labi. Dog within mecha.
Echa.
Matil Labi, but Labi me first time. On say me nchini kra me call side ho kra.
Ofro bonida.
Before be pon pa so.
Afro pon until Labi die there some from do you.
Me na me just me nyade.
When do chrono we so tell before later chrono how na Labi for.
It depend on baby abedru no. E na be mo hu say wadu fie. Ko tia de nyina ho. Enye. It was any doctor eba be din komo. Wo ye doctor hwe nyinsen ni awo. Nti yen ye femu no. Ye ta aka say obscene gyne. Doctor say sa. Somebody enu ani nyinsen ni awo. Mu fe din kakraka. Aden din akese mo tem senso a na ye dwane. Oh my god. Ejuma mu tse yi.
Bechoboko.
De radiase. Ene de asem yetiawa. Ye pese ye hwe preconception. Se obi be fa efuro. Oba na be ma hobo a e wo se oye ene niema eye akwansidi a ema ebimo enya smooth right. Yasem weni. You're starting free man.
Me that's it. Say a sha. You who say and same way per se mean saying bia or babia fa your funeral or to me calling him. Nti ye per se planning your funeral. Ye pe accidents ne be brain no.
Okay.
Ye per se planning because ye per se outcome ne ye aya de pa. Nti ne sa no na ye per se obiara a o per se of your funeral. O hwe na pomudie no bisa ne ho say person am meet me afa yefunu as meet me afa yefunu me nka say yefunu no emba ana bibisa ne me pese wa pomode ye emu ye fine ansa ye dem afa yefunu sa no fa yefunu na you expect to say outcome ne be positive enum nso na se problem bi wo ho a e pese treat ma ye bet ma hwe na ye treat ya ma nti sɛ woba ya femu ya friend ops and gyne for ya yɛhwɛ bibia ɛfa ma yare ho ɛfa awe nyinsen ho asɛm ɛfa obi ontumi fa yɛfunu ɛfa obi ɔne bema ɔba ne bema kita ho problems ni nyinaa ka yɛ adwuma no ho nti ɔba wo problem bia na ɔba yɛ nkyɛn a yɛ na etumi yɛ dɛ yɛ sa yare ne man nti ɛka sɛ yɛhwɛ ɔba yare de na sɛ yare biara ɛwɔ yɛ nipadua ne mu ɔwɔ sɛ yɛ dɛ etumi yɛ dɛ ɛhwɛ ne so ka ho nti yɛhwɛ ne sana yɛka na sɛ yɛba preconception care na care yɛde ma ɔba ansa na wabɛyɛ ɔba atan ansa na ɔbɛfa yɛfu na yɛpɛsɛ yɛhwɛ sɛ yare bi wɔ hɔ a yɛmiki sure sɛ yare no ayɛ fine ansa na wafa yɛfu sɛ impo yare bi ni hɔ a na sɛ yɛsɛ yɛ bibi nyɛma baako mmienu bi ɛbɛma wapɔmuden ayɛ fine ansa na wafa yɛfu no na yɛahwɛ ama yɛwɔ fɔ mma ansa na ɔka ne yɛwɔ mmarima nso deɛ wɔ hɔ because yɛhwɛ a mpɛn pii no sɛ yɛfunu mba a yɛde hyɛ mmaa no ɛne ɛsɛ wa anyɛ like na ɔbɛma na abusuafa akɔpɔ ɔba foforɔ bɛma bɛma no na yɛakɔyɛ ate bɛma no fa 3-4 bi na sɛ mmaa sɛ ɛhu sɛ sɛ na ɔno ne yɛde ɔno problem na mmom sɛ ɔba yɛ adwuma mu a yɛhu sɛ awɔ problem wɔ hɔ a mpɛn pii no yɛhwɛ courses a yɛde awɔ problem sɛ ba ɛkyɛ mu ɛfa mmiɛnsa yɛsɛ ɔbaa no de chefa baako na eba bema no e de baako na eba na couple no say e de baako no ne 1/3 na eba nti ka ne saa na nse ansa na nyinse betimi aba no na ejina ba na ejina bema no but ye try no a na se ye funu ne ba na no so ye behwe ndai na ejuma ne jina dai abegina oba no so nti e ba ho na se oba no apomudin enye ne papa na ema ye funu outcome ne nye fine mpempie te sɛ obia afa yɛfunu sɛbi wa wendru awompo asemato ka baabi sometimes so etumi kɔ awomo na enya problem obi so ha etumi wu wie ansa wonya sa problem nti ba preconception care na yɛpɛsɛ yɛhwɛ nneɛma yɛbɛyɛ ama ɔbaa no ne bɛrima no na ma sɛ yɛfunu ne ba ayɛ ade a yɛnyina yɛpɛ na yɛwi pɛ yɛ ma yɛ
okay nti preconception ehia pampo ɛsene sɛ wokɔ akɔduru sɛ bɛyɛ fertility treatment
yɛ ka ne saa na sɛ preconception obi wɔ hɔ onim po sɛ fertility problem obi wɔ hɔ bɛ try ansa de wo sɛ mba no aka sɛ mo problem but yɛn pɛ sɛ yɛbɛ focus on ɔmo fertility problem nko a yɛn pɛ sɛ obɛ fa yɛfunu ansa waba sɛ ɔma fa yɛfunu maba nti mo hwɛ sɛ bibia yɛ fine a adan nti na yɛn hwɛ hu sɛ wo yɛ fine ansa yɛfunu na ba ɛna yɛpɛ sɛ yɛka ho asɛ ɛna yɛ preconception care no nti yɛhwɛ yen solutions na WHO and the Ghana World Health Organization and the Ghana Health Service they aba we are trying to prevent a warm mortality amamoko a wono say solutions na they aba na your different avenues back on this obey your antenatal care so obey fire from abeko hospital na ahwe we ye ene wo ho nanso ye kasa na ye kasa ye say your friend prevention better than kiosk into prevention no mun sem na say yebehwe ansa na problem yede aba in preconception care no into yehwe preventive aspects of problem no ansa na nyinse na yede aba na yehwe bibi optimizing the pregnancy journey na when positive pregnancy experience
outcome so you positive
and one
okay into care no start free
to care no preconception care no yebeka anytime biara oba beko hospital na oye oba owo your friend reproductive age normally a reproductive age we are focusing on women between ages of 15 and 49 that's our women of reproductive age nemom oba bia that means to say obetima fire funu as person fire funu no anka anytime bia obeba yaresa any hospital no we take opportunity to do what preconception care but especially for those who find themselves in an environment in which pregnancy is possible me can say me kire oba waware unis oba ware for the den as we born ho ban finyinsen ho a nyinsen beba into at all times if you show up in a hospital unim say you should talk about a possibility of preconception care and na your yenso a enyumre bia ebukotodwa ye se nyankopon pa ise ne yefunu mu aba beba into unim say o ka san krofo you ho then preconception is for you because it is a goal in your life so befa yefunu and so you need to do your medical checkup and medical optimization as I yefunu ne ebeba nti se yefa oba na oba hospital a yene ne bedi nkita ho yahwe ne abrabom se yare bi wo ho a owo ebusua yare bi wo ho a or symptoms be or sign be or nature say maybe yare bi system nim na ya hwe na ya hwe ya examination ama no na ya ho lab na ya hu bibi atochima ya pe kwan siesie no ansa na ya ka che ne so sisi ade obitima fa yefunu
Doc, me joano see ye baby waken. Emma one, meaning I'm about one. Emma one as sebi, you bouldn't say we said you. None any general. Ibimbakas no boy who bra. We are not here to judge. But of our pnaba whom you know me and sebi and sana or quawari. Wouldn't any better say, me peba. Or we are so montaigne problem cry. Nemo momoa holy. Onde wotimi ahye ne ho so wanye memasem omo de awo ho ye de pa wo tibi na wo gidi
oh tede yete gidi no na ye issue no ye mfa ne se eya mpempin no ye feel se obi a wabobra boni nti sunso so obi te ho twen na nyame betwe na so in a way ontimi mfa ye fun nti ye expect se within that conform no omenya problem it's expectation ye judge inti a corner samba ne sa na ya ra ho se we mpo a ye say me amanye but me ma unre mfi say even though sa bra no etime de o consensus so bi to say impemu yare ye fe ne STI ne STDC e bi treatable obi so ha ne problem no enye related to that say ka preconception na enye se bi omo a omo bobra bone a ye pe say esiesie omo awodi asa na afa efu ye hwe ya nipedua no yare obu a omo jambroso obu esiche yare obu owo asthma obu sickle cell any conditions are common na ye wo ayenam ho na say yare bebre aba enye related to mpemu yare and all this yare has a negative effect on insane especially yare bi to say mo jambroso ntiche yare e anyinse bebre nti etumi mane ye fine ansa na nyinse na ba nyinse ntumi konenim so wo hwe nyinse ase with mojambroso iron control ye diabetes iron control ye o pregnancy en go bebia
oh we say dia no mo handi papa o ye di eni ho komo ye bo diabetes so ye bo hypertension so like say komo bi e bedu ya pomoden ho no ye ka mental health cra diabetes e bonidi ye bo hypertension din be ko pe awo na me siesie me body no e dey atwen awo so doctor de me na diabetes and hypertension
say e was say yet yare bia say yare bi say hypertension and diabetes e honam yare e ko honam ba bia
omo ye fun pa
nia edi honam no kan e ye brain na wakoma nti wakoma na ntime nya djuma pa ba bia ntime nkoye diabetes was the same problem nti so ba fa ye funu a you must have a very strong resilient body nti say diabetes na hypertension be say body na we den e fa ye fu e ma boy na yare nyepa sickle cell na yare yare especially when crisis to obi on frequent crisis now nim say body dey ready for insane need to be ma weak it mean ma immunity ba form nti ba ne sa na sa yare ma boss e be ye worse nti ma bo common conditions anytime we be fa bi automodin sisi ane na common conditions ye twi cancer be kan we mu a na common conditions o bo yare a common ones about diabetes but hypertension o beti cancer ena nanse be ba
eso na man kan ye common sa o
oh na wo ho na mom sisi ana ata akosoro mo ye mbra sesa yakohia stra enti no nyina aka ho enti ba preconception a oba side no say ye yi nya wo kan STD ni ade a ye ka sa common conditions a yin say na say aba bebre amafo bebre wo bi nti o sa wo hwe ansa na ya ba be hwe se o mpo obi wo ha ni hormones ha no ye say yare bia by friend peacocks and na young girls ni na so some more peacocks and almost say and no say yare ha dwin pa I say to me hwe na say wo bia ya sisi na mana ye funa ye aye fine nti no na ye ka say preconception kan nyema bebre wo ho a ema nyinse enko nanim fine ehwe ne ku ema nyinse mu a ye friend say yare a ema moja to ete ba from ye friend anemia yi eno so kan ti moja ni correct level na say wo form bebre a ntimi fa nyinse enko nanim ye nti we nyina nema sometimes nema nkete I say the CC ansa ye defo na ba na ye funu ba o clinic na ye fine and say nice or ye fine
dɔkɔ ka PCOS nti yɛka mmaa ɛhaw ne bia yɛhyia ɛwɔ yɛ fichi kro ɛne awo sɛm mu a ɔne saa te bia PCOS me besa the possibility say ordinary mother me who se me ba ebenya na wo PCOS ɛyɛ high basa me bebu ne nsa na me ne wo nkita hodi a ebia na science na mo kyerɛ no ebi ama me hu say problem say ɛwɔ ho so bad time me mama yɛ nyina mpɛ sɛ ɔmo nyame dom ɔmo a mo awo ne bi ɛdeɛ na ɛwɔ sɛ me yɛ ɛde boa ɔmo in the area of PCOS.
Oh, so the PCOS side now, I think say nansa ya isa for be why ya diagnose PCOS no be bredodo. Enye obia ni menses ye irregular. Na say ombu ni nsa na ye PCOS. And sometimes since I say a train nobody no mature to a certain level. Nti obi wo hwa 19 18 the PCOS say ya man ya PCOS. Insi hormonal axis, near friend hormonal axis, near ma or menses near there by year no. It take time it may develop it. It may take up to 25 years. Sometimes no, a per se a 2 year book a cra, and sana ye cassette will be an immense year regular, and answer was most as a PCOS. It's na a percent pempi no. When the hospital na
conception care.
When the hospital na shy, you be who so the lab and I any kasa found a bit my way and a bit my something else in Nebeka or bad time dear. A be encourages say Sisia no near high some kind of trana lifestyle. Lifestyle no sisi obi sorry a phone ni TV ni exercise. We don't move. Impempo say ni na mfo piempo na ye tra pa na say didimpa obi asini phone so. Ye monkomo ye nante ye mpasre ye mampe agro ayedi wabontini na bafom nti mpempi no now we are aging with a lot of morbid conditions sometimes weight loss diet exercise SOB PCOS problems
sometimes
and sometimes but the hallmark for PCOS management starts from lifestyle modification and lifestyle is focused on weight loss exercise and diet nti so be the so be trend wapomu so be maintaining correct weight nleboa into your batana so person ma enya na wa hwe mo didie wa hwe so be ye dem o me movie ya wo school a tete no sports very active when you sports I say unka ho obi aye sports be na se ni na e ba fo
why you school cry be one pay
na se ni na to etwa ina ye piepie na akota restaurant na ahwe ye phone so na asa be fie lifestyle and so bi aye ko be aye fa ka na eko person to be passer ya bon ya nante ne bon komo na se ni na to etwa bicycle cry ye ntwi bibio
yani ani ekuyo
ene na wakapa
so me pese daachi nyame hu me mobo na me ware a me wo na me wo ba na ho odin pre-conception care ade o se hyaase e fa na sen hia
bacho ane no ane se wakọ no ka che doctor so me pese me fa yefu me bi wo ho a wo se me hwe na me ye na doctor na hwe wa hwe obusua yare wo obusua nim wa hwe se wo nkasa yare bi wo ho a eye lab ne hwe nim a wo se ye man e fine hwe ma wo ye be man no so ho mpempi no amanfo sere se ye se nanse gana ye die na na mema no ahode na ba fom pressure no so dose wo ma no so nti dede ne bebre ya na obe wo kwan obefa kwan nti mo se ma fa kwan nya because mo aso ye din o na mu mema na ahode aba fom ni nyina ejina tena me kan na aduane ya ye di ni no ba ye fa ni nanse ni ma enuro na e se efre bibi aphrodisiacs na nanse e se wo ye be ma na se wo si wo yonko so a na otumi si no so na wa ya de na edi kunya ho nsano ni enroba eni huni faso ni nyina ka ho eni kumema na say yes my analysis a foma na eba fom ukohwe mema uye mema sima nkwama na wom no aba fom papa nti ni nyina ka ho nti na say the oba ni timi hwe na no kasa maybe nyama ketikiti bia oye a susanso ma wo na ye no waka ho asem nti oyo be man so ehu nya so be ba na so ahwe ode
we can say DNA nye mema ne bi ma no enka yenkomo ho but sanse ye ka asetemu asem fa nto so ewra bi ene ne kunu omaware mfie motwe awo mbaaye nokran se ewra ne ko check ya ohun so ono ne fam de enka bibia eye possible na papa no empese okọ ba ko mienu wanko bio yeso wanko kra but still ewra ne hu se hwe ba no ena okokoye assisted pregnancy at the blind side of papa no, which to me our rare mountain at least consultation can two work together later cry about for no 3 years and papa no who say ni enye onone ba ebe ye nsem bebre obeja aware oba no boldly gynecologist so no onim so okoye assisted onim so onkofa the chi ye kan ya be man hu so okoye assisted e de team anim e de pepa de na misro no na ye create harm or baby dada it tell me the say woka emema ne de you focus on the man pa abranti a mesiso ababa wa mesiso enema meye ne bia semen analysis de bia enkofo de wo form me nkoho bi no ebi ne de
nyema ye mpese obeye asmenas beba fom nyema me boss chiro insanom na doso zema yete so kra insanom na doso nnuro ayefa te bia na concussion na bitters na de bibi frafra nyema enye aphrodisiacs amema no fa enye eduane ayedi nso enye sisi a wo ye young man na osiso a edwuma wo pese wo sa na edwuma na wo peskanti eye passion nti eto eduane pasapasa yenhwe eduane di mu yie nti yendidi yie enya time ai honya exercise ena kakra ne abonse gu yere ho ya kopa be duro anom nyina aka ho ena exercise nyema ti meka che mema no se enhwe ho fi these things high na se na jot twetwa manfa no ene mu vape ni nyina nye emboyen eno ne problem no
okay
wasema o kan ma menka nsi so ye ma no e wo mpa se pempi no awari ni mu nsem start ya because of ban na ebre ona ye de gu na sum njo na etwe be ma ba hospital se mama ni bebre at that time no sika ni hiom so me si bibi am de gina so nti mo nya time asa de we ne mo ya mema no so mo nkan hu se ma no e am limited time because nya 39 ko anima na wo kosua na ho de perform anyi se ho ya dem nti we ntimi maximize opportunity before 39 40 ya na den so ebre oba no nti eba ni sana ka wo be ma no twe da hwa fe wo di 60 a why ready ebedo no ba ni di 45 50 emba wo de ofa nkohira wo nya bi nti we yiweni eyesan so mo amma no nti me ka chon so manage mo aba pempin ya doctor for ne ka chon so mo mbra na enkasa endi mo time bebre se ebe hu bebi ede command be fa ne ebe ye be boa mo nti ya mo ndwin ma no so obo wo ware oba na say up to 35 I want starting maya yeah so find it serious cause enche the time ebe ko obe come menopause na wo be ma no dem because it been what on 19 to any problem nti I say yenhwe nti ho what am I kind time dey isi sa 7 no so me ma na empempin no yenhwe na ma no so ye ne yekunu mu kasa na so mu mfin ya ma ye ntenda hwe ye ni wiase mu a wa mbra obenya ne papa bibia papa bia ye bre ni yenya nti decide so okunu je kunu ya pa ba nto so apa ba da okunu be nyane so peba no na wo de o time ko afi na akɔhwe amanfo mba because wa ware ni nti wo po do okunu nti o de bia ba wo beje nti nye sa so so tumi ne kasa na mutumi ne wan se o mre ne ukoma me manye ne ntema ebe ha me esa na fertility no ene so ede akoba nti wase mo akan time so me de eno abesim nti ya maye nhwe maye ho
doc into ideal time and kasa pre-conception care was he taking very serious anytime baby be say me wo 2028 be say me wo 2027 say the source mo mpempo free mu de ne yempo it is administrative time baby
o planning insen ya anka me anyame anasa me nyame nsa nifa so ene oba maka je so coverage na oba me nyi se betuma ma ene nke betuma plan no mpofrum so by next month oba me pre-conception na me say to mama but yes anet nti sa no ni me say person in a year's time or 2 years time no start or check up early because maybe boy say sometimes ye answer na yeden if no ba nti one kokra at least 3 months before you at least 3 months before you so I want my enough time add the nyama kakra den at year answer na nyi say den aba na moment ka me dey me say oba biara over that age bracket utumi fa you no dey anka wanya do hospital no dey bo ho nkomo oh doc minya nka awa nka be wo nti bibi wo so me ya na no ye den ndi ho nkomo na won plan maybe person lose weight yeah man 1 week sisi akose weight yeah man sometime cause time ho wo maybe person wo BP no nye well control na if e draw a bit me dey amount cause me man rain fit sometimes e draw no bi wo ho a onyima want me fa me hu so no na ejo nti ama BP na nye fine answer no anko na e correct ma wa be fa e funu no na esi o BP no nti asemesi nti no na ye ka wa asem no bi wo a essence sa ya bi wo say man ye fine ni bi wo ho say so ye enna yesi nyame mmere ne mrepa nti take it time nti so to me contem nti me ka me nko a oba bia onim se wonye ready for why ready for nyinsem anasa wo mbo wo ban finyinsen ho de ke so start komo at one point your life was start and nya say I was sell o gynecologist ho nya doctor bia ne ka ho asem obetima start ama utimi ye hu ye obstetric gynecologist ye adwuma ne ntene wa bedru fie obetima hwe wiye ne mo ni doctor bia de hu nkomo a obetima start ama na se bibi wo ho a refer to nipa ese de wa hwe
Abuzua ye ne doc di nkomo de afa ahobo e wo se ye de ehwe nyinsen kwan na nyinsen no akwadwojo ni awo eba ye pe na sinto ye betimi abɔ ho ban yetimi abɔ ho ban eno na doctor agibre awon ye di ho nkomo wa hoboa etese de ne ya na wodwe ne ma wodu sika ye no de hia wo no ya na we no ka ho ana eso awo ne maya wo se na wo hen apoto na oje ho ba bia eni eno tu beto ye nkomo iso a wo so fa ma obi a wo su se beboa no awo ho senka ye ne drum bia na aye emotional etine ka no na aye den wo so na fa ma obi bia na aye hira de amano widase doc ebra ya ba begina ya hwe emma ya hwe emmema no kakra na ya hwe ahoboa no ebre at least o se be say 3 months bidie o se o 2 anamonansa me fan say menya infection pain ebre bia ba besne ko me treaty yem fan say treaty se me ko pre-conception clinical emfaso ben na menya obi a me wo a history of infection ewo me reproductive health
okay nti say ye per se nya maximum benefit for preconception care na in terms of sexual reproductive infections no most of the time no you really say we may have infection it doesn't show
okay
into which man na infection be how we nim say wo and the preconception will help you pick it up and treat it
okay
so when you be pen away treat it down as you treating year any problem yeah
okay
but you may have ones that you don't know are there in fact you are able to say HIV say STI they know the example so won nim so wa now we starting fin draw we be draw ho now be fine fun now we need to form the dark and never high fun be fa abofra no what if we draw now virus level now very good almost undetectable it's very good for you
okay
it be how active infection when you are aware oba na e kan e lab na hwe ma wa e bitman but if you already know say for example the same HIV or you know say what HIV did that na say drone na fa no na say drone be why you feel say enya good for pregnant people because there are different types of medication
okay
we have ones that we prefer for pregnant people you be switch akwa no and that's for almost all conditions and HIV nkwa mojambro so enya drone na na good for it is it enya good for nyinsai until bad you be switch to a drone you prefer for pregnant people no, so that over your funa send drone anko ha abofra no you are trying to prevent your body from having a problem but the drug no could have a negative effect on your child until you switch it to pregnancy preferred medication And that's what preconception is about. It's about optimizing your previous health and the STI in all health conditions. You'll be a friend supplementation. I pay for you for you can say Fedro, now folic acid, and now pray I pay for you iron ni vitamin C ni adi. Folic acid, your person will start for up to 3 months before your flu.
Okay.
Because you need to build the folic acid reserves before your flu. Because it's very important in preventing major conditions of pregnancy, something called spinal bifida. And you want you to have enough folic acid reserves. And you do better so. So moja will form iron supplementation. Into your supplementation amount before pregnancy when we think you need it.
Okay.
All right. Obuha immunization be on yeah. Some immunization we don't prefer it when you are pregnant. And we want you to complete while starting part. Sometimes we want to make sure optimal. When you are pregnant, we give you tetanus. Okay. And if you have the option of starting before, why not? And there are some immunization you may have to complete before you get there. Maka alcohol one sem. Be a week be a what started habits to avoid. Some people actually enjoy the alcohol. And getting up one day to say stop is not good. And if we don't plan pregnancy, now say hey, guess, now weekend we work last week only to figure out that you were pregnant this whole time. It can affect your pregnancy. And once you know that I am trying to get pregnant, then you start dropping your alcohol. So your body is good. Mpempi na man for sure. Because on back clinical, me malaria be say oh you 2 months. So kai kwe ubi no ko Easter bri. Ni say na ko sepe ho ni na obi ye nyeme ya. No Roman you say oh wa haneba. And that's what we are saying. Don't you say ba you know because alcohol, drug, until even your normal medication how to. And as our lifestyle eduane a wodi ni ade nya fine. Anyone can wa pick optimal things. In the preconception care, some of the focus things is about those ones.
It's matter see ya. Na a more of preventive health a fa awo.
A more preventive health and when you find optimization.
Ba said you opewunya ne said you pay. Don't say yeah ha say no yenyare a yenye side of the world yenyare a hospital call yempe.
Okay.
A dear intina was yes.
Yen share history kakra. E wo say yare en hospital nso fie biara. E wonro. Wo kwai a onana beka say time aso beje drobe, beji we. Omi na we prevention. Emu na yen hospital bre. Hospital setup. But we did. Our lifestyle culturally is preventive. Okay. Yenye fie. Even the dempo area yenye mental health. Anana montiasia. You see primary because you may not see what you are doing. Inti ma bebre one painful bra se ma yenye because it had a social, cultural and health implications. Inti our cultural setup is health oriented. My Canada yo. Yeah, here na nana mo ahoden sin embre because edwuma no mo yenti. Nti our cultural setup is health oriented. Right?
Almost said no almost see health oriented. And yeah.
That is why we are, have this conversation with because we know that we have a different lifestyle. No. And some things must be talked about to open the eye. Se nyama na face ye finance ye nye. Nti e ba ne sa dia in Fambra Hospital. Okay. Nyama bibiri wa ye jai kire ye ma. Se na oba siesie no ho oboni nsa. Nya se ye kire ye ba bi. If ye nyama na ebe ya ho be tika ye nye. Aka se enro ede hye ya se emwa ye.
No de ye.
Enna aka. Kaya mata. Ene ni je ho. Ade pa no ye hwe ho afi ho. What you say? Kaya mata ye hwa. If ye na mo broso na de abetu but eno na ye fa no. Ene ja papa no nyina gu nchen. Until we are always health oriented, health conscious, but set up naide as a sakra. And we are also pushing said there are things finance, we are financed it into a better. Into na yen ye bohu de rene ameno kasi say won kwa to be nya fabra na yem wo na so wo sane no wonye yen to me nyem ma no kra nyame ni enye yare abeba doctor ebe ebe you
Obe swallow amount.
on swallow amount.
Just say
why nti ye no link ta ho na ya kire kwan ya feel say ebe bo na we choose me awo betumi aye de aye nti ene wo kasa na we hu say o ade we me ne si ebe bo a ye ne si ebe bo a nti na ye ka me bi patient centered care nti wo na wo be ba no ene wo kasa na ya plan it together bibia we asi coach ka ho an ye koyie ye share football. One of the biggest sports, all the sports coach will and they say they do healthcare, they want to throw a healthcare coach away.
Who is a doctor?
Not necessarily, say health worker, say a doctor, say a nurse, say a
midwife,
say a radiographer, say a laboratory. Obiara when a juma ho. Obiara in the juma ye pepe pa ye nim. Abayan ministers, your presidents, they lead. Into every area has its experts. And if you want to excel in that area, you see the experts and you will excel in the area.
Look, finally, yani yesu sika bebre inti unya ka preventive ana steps to say preconception here. Ye share and amenyare na me diske ko hospital. As against matwenya 2 years time emma awo me hwe kwan emma ya afei me run test bia bi to that test no kwa kwa na nketumi tua preconception care emma wafe efuto be na ade ma wo
Ejuma me na de bakọ ya me ya pa ne se waba hospital na wabe wu hospital uncha o kan yan fa ofun ko e na me wa uncha kan fa ofun ko e
nipa na anye ye
but Canada ho enna a car if you are it's always higher than preventive car. So unya nyinsen that's all BP kosro. And I mean people unya condition friend eclampsia na my soro count na otwahwe. Sa yare ne kan hospital wa car be bono. E be bro car uchi aya o control BP na sana nyinsen ne ba. But emphasis kasem na nto nchen. Na me bisa wasem se. Hina e be ka chere ne se wo maami iwu taska we bana menje ne nkwana mka se oskana no board nti manyu
yenia no
ni so ni bi ansa nti se nkwana ho hia wa ene skana ne yafu ene se adwen ho and me pa ucho yes e wo yi broni se catch your coat according to your size. There are several levels of healthcare facilities in Ghana, from private clinic to government, all the way to what we call the CHIPS compound. Everywhere you will find a healthcare worker. Until don't go to a place sikano boarding mau, I'll bet my call lower more place. Until don't when Bobby bra, but wow bra. I didn't hear now ye. When you say papa premier care, not they be our person will be able to attend the prices about form. But still there are some people they cannot come here. No matter how you attend price about form. Be why then. Obi oye kaya. Sika unya no. Want me from dad mission or one day. In a normal circumstance. But to be one of it me aba. And I'm a boy. Inti overcome government hospital. Abaya ye national health insurance. Amaye. What to make government? Inti na nka say me twen aboa me sika ho. Ade akwa anade akwa ha. Bibia fa ho bia kwa ya se bia. Utimi preconception wo ho. Na wo twen na yara ne ye den bia test no do so. Because so diabetes ba e be ho test, with hypertension ba e be ho test. Wonko a the for ba e be ho tests. And now for you funu na say yare no wo ha test no so still a do so. Nti sometimes so yeah compare
meaning say e no quite cheaper.
Sana some person catch up. But me the any process any cheaper mpa e nkwa. Price be na dey aton kwa no so. And that's all dream now.
Doc here pokra no to a young woman watching us, a young man watching us. Unyaya dachi obewo bi. Na ho boa wo ye can be brave, but in a nutshell, you're the Gynecologist.
I'm the Gynecologist in a nutshell. We are ba. You are in your reproductive age. You are sexually active. You are not on contraception. sɛ meka ne saa na ayɛ sɛ wɔte hɔ yi wɔne bɛrima hyia wo nso a wontwe wo ho fi nyinsɛn ho ɛnea woyɛ risk for nyinsɛn nyinsɛn ne ba a ne yɛ sure sɛ abortion yɛ wo first choice woyɛ the nyinsɛn ba a wobɛfry so de wobɛwo nti ɛte saa na if you find yourself in a hospital, talk about pregnancy, preconception care, and pregnancy planning. If you are not in a hospital setup and you are free, walk up to the hospital and say, oh, I want you to come and do checkup. Preconception care, you need your supplementation, so folic acid, or iron, or vitamin supplementation, immunization, investigation for your ABO or such as STIs, I can say me. Other condition won't nim say or what to say diabetes, hypertension, asthma, sickle cell. Ya can was them and then bema numpo on the neba and dink it down. No so problem get why I saw be amount. Na no wakasa maybe unya we mpo say sana me kai age 35 yi e ba be pen anase e chew. Nti ba na obete say say na yare nketikiti bo ha menya we say me wo. Na no waka wasem. Na wo fie na say wontimi ni na at least wo folic acid supplementation there. Unya hu say o menya menyim no start e fa. Ansa mpo abeba me nche folic acid there e nya prescription e dey ato. That's the only one I will allow you to do without consultation. But in kind of come, let's have a conversation. You need a labs. And the conversation alone to figure out for you or bad. Then now walk me here a different from your uncle bar. One sister by and the same thing. Mom to me now. Same age, same mother, same father. Then the same thing. Me now. Until bar the discussion. Natural, quite no. Nutrition, lifestyle, weight, and alcohol and drug abuse. She's tone it down. She tone it down. Indiscriminate sexual activity, she tone it down. HIV near does.
Indiscriminate sexual activity. Doc, let me see a point. But emergency contraceptive pill and fertility chances.
So, in short, emergency contraception, yeah, time I didn't say I didn't ready for the insane and to prevent it. And as a doctor, we prefer regular contraception to emergency contraception. Because emergency emergency, but chances near lower than regular. And the more emergencies you take, the lower the efficacy is. And the more often, then the more chance of being especially for more than one in the same menstrual cycle. And to me, prefer self-befano multiple times. But the way it is designed, it doesn't put you at a high risk of infertility. It won't put you at a high risk of infertility. The contraception itself is designed to prevent pregnancy when you're not ready, but it doesn't really block your fertility chances. Now, if you are doing emergency contraception secondary to indiscriminate sexual activity, then your sexual activity risk of STDs and then infertility, but no contraception now fire. Into sexual infections are being through the unsafe sexual activity and then block fertility not so much contraception or fire against the flu.
We are more risk. There is another higher risk.
The risk is not really so much from the emergency, but the way I'm for medicine and saying problem like a crowd say I can't say it doesn't cause the infertility. But don't forget, it is designed for one-time use. Until if you use it one-time, your risk of other problems are lower because a draw will have this in society. So, but it is safe as long as it is used the way it is designed to be used. If I be brave, then we increase the risk of problems coming. And there's amount for tears. Then your chances are you are better on a regular contraception than emergency. Obi will feel say, oh, my partner near around. Into my emergency about once a month. Into once a month you swallow emergency at high dose, as opposed to low dose every day, which at the end of the year, between the two of you, nipan of emergency once a month, has a higher risk compared to nipan of regular throughout. Into yeah, mom brand then discuss it and find the option that works for you, then we'll have a better outcome.
Doc, me that's. I won't bother no why said only boom. I might be the I want no be home mobile or Sameka. About time, if I see any common be a yard hall. na ɛmmoa yɛn yɛsiesie yɛn ho siesie yɛn mma ne yɛn mma mmarima na obi a ɔbɛka kyerɛw sɛ awɔ nyɛ da bi awoa wɔanyɛ bia ɛnyɛ hwee basi nyame dom na kwan mu yɛ ma wa baby ɛbɛboa wo wodase wonim sɛ mahoɔden basa so no mewɔ ɛnsia insurance mepa wo kyɛw mesrɛ wo ɛnsia ɛwɔ insurance policies a general insurance policies motor insurance goods in transit travel insurance home owner policy and other allied perils na kyerɛ sɛ ɛyɛ ɛnsia insurance wone insurance bi a hwehwɛ bi ɛyɛ very very necessary ɛwɔ abrabɔ yi mu medase nsuo no meka kyerɛ da bia sɛ yɛanom X natural mineral water ane X natural mineral water you can never go wrong nsuo yɛ ma nipadua no menom X baby am bia kuta me nti no mo X na nipadua no enya no menom ebere bia no menim ɛyɛ Emis Etikon matade sɛ yɛ ofa yɛ pamo TMC fashion center ɛyɛ whole family fashion center thing opa atade a wode kɔ outdooring wode kɔ asɔre wode kɔ eyi kaftan suit ade kɔ adwuma bibia wode one yɛ nkasa you're ready to wear session you wode yɛ pam custom made ɛwɔ hɔ no mu yɛ be yɛ good pa just follow the link ɛwɔ yɛ bio no mu na one yɛ ɛni nkɔmmɔ ɛwɔ hɔ no mu the very generators where power needs ɔboa yɛn ɛmɛbrɛ bia yɛnya power na yɛde abɔ yɛn ho bra ɛwɔ de yɛ bia wo event ase na ohia power source a ɛnkɔ back and forth the very generators you just call them on bɛboa 1 year ago my dear sister aduane na wodie no drink na wofa no ɛde ne wo mu memenim yogurt so mfa so eti menom 1 year ago ɛnyɛ any other yogurt me choice ɛyɛ 1 year ago menkɔ mfom so menkɔ wrong dan to so pa fantom abɛpɔ me dia no wo mane maboafo a wo nti ɛna mtem de talk life bro what did I say akram